Today, we're going to calmly unpack a topic that often appears in frightening headlines: the brain-eating amoeba. The name itself is enough to cause significant anxiety. My goal today is not to scare you, but to empower you by separating fact from fear. We will discuss exactly what this organism is, how an infection occurs, the symptoms to be aware of, the current state of treatment, and most importantly, the simple, effective steps you can take to keep yourself and your loved ones safe. It's crucial to begin with this fact: an infection from this amoeba is extremely rare. However, because the consequences are so severe, knowledge and prevention are our most powerful tools. Part 1. The cause. What is Naegleria fowleri? The organism is a single-celled amoeba called Naegleria fowleri. It's a natural part of the environment and thrives in warm, freshwater bodies. This includes lakes, rivers, ponds, and hot springs, especially when water temperatures rise above 80 degrees Fahrenheit or 26 degrees Celsius. This is why cases are more common during the hot summer months. It's important to know where it isn't found. It does not live in salt water like the ocean, nor can it survive in properly maintained and chlorinated swimming pools or water parks. Now, this is the single most important piece of information. How does an infection happen? You cannot get infected by swallowing or drinking contaminated water. Infection can only occur when water containing the amoeba is forced high up into the nasal passages with considerable pressure. This typically happens during activities like diving, jumping, or water skiing in warm, fresh water. From deep within the nose, the amoeba travels along the olfactory nerve directly to the brain. There, it causes a rare but devastating infection called Primary Amebic Meningoencephalitis, or PAM. Part 2. The symptoms. What to look for. The symptoms of PAM can be broken down into 2 stages, and they progress very rapidly. Stage 1 symptoms usually begin within 1 to 9 days after exposure. They are often vague and can be mistaken for the flu or bacterial meningitis. They include a severe frontal headache, fever, nausea, and vomiting. Stage 2 symptoms appear as the infection worsens. This is when the neurological damage becomes apparent. These symptoms include a stiff neck, intense confusion, a lack of attention to people and surroundings, a loss of balance, seizures, and hallucinations. Sadly, the disease progresses so rapidly that it is almost always fatal within a week of symptoms starting. Part 3. The precautions. How to stay safe. Again, millions of people swim in lakes and rivers every year without an issue. The risk is very low, but these simple precautions can reduce that risk even further. First, assume it's there. In any warm freshwater body, it's safest to assume Naegleria fowleri could be present and act accordingly. Second, block your nose. This is the most effective preventative measure. Hold your nose shut, use a nose clip, or simply focus on keeping your head above water when in warm, fresh water. Avoid activities like jumping or diving that force water up your nose. Third, don't stir up sediment. The amoeba lives in the mud and silt at the bottom of lakes and rivers. Avoid digging or kicking up sediment in shallow, warm areas. And fourth, a critical point for home safety: use only safe water for nasal rinsing. If you use a neti pot, sinus rinse bottle, or any other device that puts water in your nose, never use untreated tap water. According to the CDC, you must use water that is distilled, sterile, or has been boiled for at least 1 minute and then cooled. This is a completely preventable route of exposure. Part 4. Diagnosis and treatment. This is a difficult part of the conversation. Diagnosing PAM is challenging because the early symptoms are so common. It typically requires a spinal tap to test the cerebral spinal fluid for the presence of the amoeba. Treatment is aggressive, but unfortunately rarely successful. The survival rate is less than 5%. A combination of drugs, including an antifungal drug called amphotericin B and a newer drug, miltefosine, are used, but the key to any chance of survival is extremely early diagnosis and treatment. This underscores why our focus must be on prevention. To summarize, Naegleria fowleri is a serious organism, but the risk it poses is very, very low. This isn't about fostering a fear of water, but about building a healthy respect for it. By understanding where it lives and how it infects, we can take simple, common-sense steps, like using a nose clip and only using sterile water for sinus rinsing to protect ourselves completely. I hope this has provided clarity and reassurance. Thank you for taking the time to be informed. Stay aware and stay safe.